Hi guys, I come back on my second episode. This time on my economic podcast will be different. Today we're driving a new story. We're driving with a new personality, with someone you're gonna be surprised that we met in some way. I'm very honored today to host Dr. Abdul Bari Khan, a visionary who's really changing, and his story have changed the whole healthcare system and landscape in Pakistan. On his field and my field and my industry, people we seem find us different, but we met. We're having an impact to change life, whether real estate or healthcare system. Hi, doctor. How are you doing?
I'm fine. Today? Thank you for
It's been an honor having you here today.
Thank you.
Can you just have a small brief and story and let people know who's Dr. Abdul Bari Khan?
I am a cardiac surgeon by profession. I was born and brought up in Karachi, Pakistan. And from my childhood, I wanted to be a doctor. So I'm fortunate to be born in a religious family. My parents were Tahajjud Guzar. My father was in a habit to loudly say prayers, dua for his siblings, their kids, and his own kids. So the whole of my life I had heard only one prayer for myself, that make Bari doctor to serve the humanity, nothing else. So Alhamdulillah, I joined medical college in 1979. Attached to it was a civil hospital, Karachi, which is a public sector hospital. At that time, it was in a bed shape. Beds and doctors were available. Rest, it was out of pocket. So the poorest of the poor from interiors of Pakistan used to come to that hospital. So every patient had a story. Someone selling their cows, their goats, their houses to just get treatment to the kids. And I have seen and heard many parents praying, may Allah take him. It's not a bad deal. Save one, let him go one and save 8 back home. So we as a student formed an organization, Patient Welfare Association, where we used to provide, collect money, donations from ourselves, from our families, and provide medicines to these patients. Then we established the first voluntary blood bank in the Medical College, Civil Hospital, Karachi. Before that, it used to be the professional donor drug addicts who used to sell blood once or twice a week. They had everything in their blood except blood, hepatitis, malaria, syphilis, and whatnot. The dream of Indus Hospital was I graduated in 1986 and started my house job. And the dream of Indus Hospital was seen in 1987. Post bomb blast in downtown of Karachi, where 75 people died and about 500 were injured. I still remember dead bodies coming into the emergency and injured. The beds were full. Then we basically treated those patients on the floor. But one good thing happened. There was a long queue of people waiting outside to donate blood. There are many people having money in their shopping bags to provide medicines, to drips and everything. At that time, I realized the nation, Pakistani nation, is a different nation. In crisis, you cannot match any nation, be it the earthquake of 2005 or floods of 2010 and 2011 or COVID or flood last year. And it is irrespective of the religion. So we had blood from Muslims, Hindus, Christians, everyone was, and they were donating. So when we were over with this crisis, we thought we will rebuild the emergency department of my hospital. And at that time, we got a plan made for 100-bedded emergency department and started collecting donations. The budget was 3.6 million. And for the first time, we went to school kids. We gave them the money boxes. And out of 3.6 million, 2.4 were raised by these school kids. 300,000 were in the form of coins, 5 paisa, 10 paisa, 50 paisa, and a rupee was the biggest coin at that time. There were 40 sacks full of those coins basically, and the challenge was to convert it into a rupee. After that, my colleagues, we all dispersed. Some of my friends went to UK, USA, Ireland for post-graduation. I stayed back in Pakistan. My father was paraplegic, and I had to look after him. And he used to say, you will get so much into this country which your friend will not. And alhamdulillah, Allah has been very kind. So my mission was to be a cardiac surgeon, because at that time there were only 2 cardiac surgeons, and there was only one public sector hospital where cardiac surgery was performed. And the patients used to come from all over Pakistan. And the waiting list was about 3.5 years. And we knew half of them will not come back. So because there was 2 theaters, 10-bedded ICU, by that time, people knew me doing charity, doing public service. So they used to ask me if you need any money for heart valves or medicines. But my mentor asked me that if we can increase the infrastructure, the masses will get the benefit. So within 3 months, we raised about 80 million rupees and established 2 theaters and doubled the capacity of ICU. And the waiting list came down to 6 months. After doing my fellowship, I was appointed back to in my alma mater, Dar Medical College and Civil Hospital, Karachi, as assistant professor of cardiac surgery. And I was told there is no funding for cardiac surgery for next 3 years, which I knew. And I knew I have to make my own department. So I gathered few people, formed an organization by the name of Friends of Cardiac Surgery, and established the first cardiac surgery department in province of Sindh by private donations. We did first operation in 2000, and up till now we have done 13,500 open heart surgeries, all free. In 2004, my colleagues came back, we regrouped together. I reminded them that we had seen a dream in 1987, now it's time to realize it. And in 2005, we started working on the new hospital. And at that time, people were skeptical that we will not be able to do it. We'll not be able to make it. If by chance we make it, we'll not be able to run it free of cost. Someone gave us a month, 6 months, or a year that you'll be starting charging patients. August 11, 2024, we are 17 years old. We started with one hospital of 150 bed. Now we have 15 hospitals across Pakistan. We have multiple primary health clinics, and we have blood centers, we have physical rehabilitation center where we manufacture artificial limbs.
I'm finding myself speechless. I'm just quietly listening, because usually I prepare a little bit script and I try to stick to it. But unfortunately, with your presence, with this kind, for me, it's quietly a book to learn. And I'm very honored again that I'm sitting with a very humble personality, which has been changed. Not only the healthcare infrastructure, it's a holy mindset. I think that I'm quietly touching, because the story was very how to say, it's too realistic, too human, that you took your parents' responsibility on your shoulders, a whole city or a whole village which you born in. You choose to listen to people, to change their lives, to save their lives, and to work to fulfill the minimum rights they need is to live healthy. And what you do, doctor, for me, quietly doesn't need to be a Pakistani. It's something that you're changing a sense of humanity in the whole world. I'm Tunisian, and there are a lot of wars going on. A lot of people needs help. So for me, as Pakistan, I learned a lot from them. I've been working 10 years with them, and I know the culture, I know the mentality, and being human, what you do, it's not related to any religion, because you're just curing, you're just helping people to save their lives, wherever their background, wherever their nationality, wherever their quietly belonging. And it's very, very authentic to understand how important to deal with this part. I've been in Karachi myself. I visited the hospital. And to be honest, that's why drives me today to be with you here, because I never see and like there is no cash counter hospital. Everyone can pass by and get the cure, medicines, and leave. Especially you have like how to say a sector for curing cancers, and this is very, very impressive, because I want people to understand, especially now as a real estate expert, as into the business. My passion go beyond buildings. End of the day, property can be a location where we can use it to improve and maintain and sustain life. It's not only about profits and income. And mostly here in Dubai, as Dubai is linking the world globally, and there are lots of big Pakistani developers who are maintaining a big state here in Dubai. I would like to make a small call early in the podcast. I couldn't stop myself to let them understand how important to be part of what you do. No one obliges you to do what you're doing, and no one push you, but your passion, your feelings, you're totally touching sense to help others. Just explain to me, doctor, how do you think that like these part of investors or these people who are from the same continent, let's talk about Pakistani, how they can be part of changing the whole society and community, not only about Karachi, I'm talking about the whole Pakistan, especially you're running a whole foundation of donation, and how important people to understand the importance of charity.
Fortunately, the people of Pakistan are philanthropic. As I told you, during the crisis, they react and they contribute. So definitely we are running this hospital, and it runs on money, which is zakat and donations. And we have, it has been, when we started, about 92% of the funds were raised from within Pakistan. But now we have registered charity across the globe, and Dubai is just 1.5 hour flight from Pakistan. And I've seen people, they donate. And they just wanted to know a credible organization which has the credibilities, and they donate, and I see, and it is development, basically real estate, whatever business it is.
Yes.
If you do business with Allah subhanahu wa ta'ala, then there is a barakah into it. And people realize it, and they do it. They just look for a right avenue to invest their zakat or their donation. So it can be, now because we have expanded from one hospital to a network of hospitals and public primary health clinics. So our expenses have increased manifold. Our first year budget was 100 million. Now it is about 57 billion rupees. It is almost $180 million a year. It is operational budget. Expansion, leave aside the expansion, which is about 300 million. And it is not only the village of Karachi, it is across Pakistan. So we have, in 52 districts of Pakistan, we have a tertiary care hospital in Karachi. We have a 600-bedded hospital in Lahore, which was made by a few families there only. From their contribution in Lahore.
You've been mentioned that I heard that you're registered with Dubai Humanities, and I guess Dubai is leading these investments on healthcare, and globally, especially when we talk about Waqf, Dubai is one of the role model for these kind of things, especially with Emirates Crescents. I just want to understand, what is the impact of being very close as Pakistan, as you said, 1.5 hours to Dubai, and how the impact of Dubai to the foundation of Andas Hospital. And you as a doctor, I heard that you're already having some seminars sometime, and while you can networking with people and explaining how important to understand the result and the add value of doing a charity and saving life.
As I told you, about 92% of funds were raised from within Pakistan when we started. It gradually increases, then we enrolled ourselves, registered ourselves in different countries, USA, UK, Canada, Australia, and Europe. But Dubai, then we came to Dubai because we knew most of the Pakistani uh, developers, businessmen, they are flourishing in this part of the world. And there is a mechanism, the International Humanitarian City, where we got ourselves registered. So it is knowing them, they want to contribute, they have zakat money, they have a lot of donation also, they do over and above zakat also. So we wanted to showcase ourselves, and it has proven. Now the contribution of expat Pakistani is about 30% in our annual budget. So people who live outside Pakistan, they love their motherland.
Of course.
And they want to contribute to this. And they look for a credible organization. And Alhamdulillah, Indus is an organization which has a credibility, so people can rely on that.
Yes, and sometimes when we talk about real estate and clients, when they told me that how the investments or the property can be more than an investment, what kind of legacy we can create behind, I just want to ask you as Dr. Khan, for sure you're humans, for sure the personality you're having is different, and maintaining from a place where you grow to help others. I just want to understand what legacy you want to leave behind for the new generation, and how we can, how to say in English, how we can water their feelings of humanity, especially nowadays with the social media, the technology. There are different feelings, like the era and the time you grow up with these family sessions, with feeling to others, with helping others. And nowadays, to be honest, we are into a lack of it. How do you think we can water this legacy?
Partly I agree and partly I don't. Because I go to to universities, colleges, schools. There is a lot of potential in the youth. It is our responsibility how to channelize them. It is the responsibility of the parents, responsibility of the teachers, and the responsibility of people like us. So, because they look for role models. So if they have role models, they will follow. So I think so. And as I've experienced people talking, I went to one of the schools when we started one program, which is Tarbiyat. And when we
education.
We go there and we give them the money boxes and they collect money. And when the day is when we have to recollect those money boxes, I personally go there and talk to those kids. And the Tarbiyat program is from class nursery to class 5. So I was just asking questions from these kids. So I asked them, what do you want to be? Someone said, I want to be a doctor, I want to be a biomedical engineer, and someone want to be a nurse. Then I asked them, how you will help in this? Someone say this, someone say this. One class 2 student, 6-year-old, he said, I'll collect 1,000 billion rupees for Indus Hospital. A 6-year-old child, he doesn't know what the billion means. But I'm sure that kid will do something in life. He will be a role model for many to follow. So we have to work, we have to be a role model, and then it is our responsibility.
Yes, and I do believe that. And for me, I'm very glad that you are here with me, because that gives me a sense that my content is worth to view, because you don't appear much in any platforms. And I know that when it works about content, when someone show a very good important content, I don't look about the trends, or I don't want to be making a buzz, as the French says. I don't want to make any propaganda. I'm making this for the people. I know this target will target the right people. I don't look for people just to view my video or view my podcast just for the sake of viewing. I want people who will call to actions. I want to raise my voice and help the people over there in any place of the world, because I do believe that humanity doesn't have nationality, and as you mentioned, no passport, no ethnicity. We just need to be tolerant. We just need to be humans. And from my side here, from my place here, I believe 100% on the foundation you're talking about. When we talk about donation and a free healthcare service for everyone, when you give a right, someone doesn't have right to be healthy or to be happy, we are trying to retrieve rights to the people, that this is the minimum things they need. How you find yourself in middle of this? Especially, I knew that in COVID, you were the safer for Pakistan health system. I heard that you are one of the game changer on that crisis, and the pandemic was very tough, especially on the system which was collapsing, and you came to save that in a minute, which was in a time was lost. So I need this from your side.
No, it was, I was not the only one, basically. It was, I think so, that how Pakistan tackled the COVID situation was the collaboration and cooperation among each other. The public sector, the private sector, not-for-profit sector, they all sat together. There was a central control and command center, and we rightly took decision at a right time of lockdown. Mm-hmm. The first lockdown was done in province of Sindh, and it was complete for 15 days. And whoever where it was told to be there, don't leave. Intercity transportation was closed. Aeroplanes were closed, trains were closed, no buses, no taxis. So that really changed the scenario. It was tough time. Those 2 years, I think we will eliminate from our life that we are not 62-year-old, we are 60-year-old.
I know, I can understand, especially when we talk about Pakistan, we talk about overpopulations. It's end of the day, we can't deny that, when you had an overpopulations, the way of poverty will be more rate. That's why we're talking about donations, because the people who needs our help are more than what we expect. It's not only about health. When we talk, the people, when they found, if they are sick, if we considerably they are sick and they have money, they will better eat and feed their kids, and instead of curing themselves. That's why when we talk about donation, we are talking not about saving only a life, we're talking about saving a whole community, because when we're talking about a family, we're talking about a whole entire generation. And this is what I learned actually when on my trip to Pakistan. It was very, even emotionally, it was hard for me to see this. I am not used to see this face to face and to experience it myself. That's why I decide, the minimum I can do is to raise my voice and talk and help and call for this. Because end of the day, if I'm just sitting and looking without any actions, I'm already helping the problems to be more worse. So this is from your side, in your age, with all your experience. I just want to understand, traveling all over, helping others from all over the part of the world. What is the more message you want to give to everyone who's hearing us today?
More message is basically the healthcare is not only to define health. It is not only mental health or physical health. It is environmental health. It is social health.
Yes.
So, if you are poor, your mental health cannot be cured unless we relieve the poverty. Mm-hmm. If your environment is not correct, if we decide as a state, the government decide that for the next 5 years we'll do nothing, just provide, our effort will go to provide safe drinking water and a good sanitation to the population of Pakistan or a country, whoever it is. Mm-hmm. We can eliminate 60% of our disease are waterborne. So if we can take which is not costly. My dream is, may Allah give me so much life, we will close our hospital. We'd like to close our hospital which we have made. If we can have a good comprehensive community health and a primary health care, there will no need for hospitals.
Mm.
In 1987, when we were making the emergency department, one of the donors arranged an ambulance, Mercedes ambulance from Holland for me. And when he handed over to us, and when he was leaving, he told me that if you want, I can have a donation of a full hospital from Holland. So as a young junior doctor, I was astonished. How can you get a full hospital donated from a country?
Mm-hmm.
He said, and the hospitals in Holland are being closed because there are no patients. They have hospitals for children, kids, and they have hospitals for elderly. Young, because their primary care is so strong, the people don't need to be hospitalized. 1987. It is 38 years now. We are still wanted to make more hospital to in many areas of Karachi of Pakistan. But if we decide today that we want to change the healthcare scenario of Pakistan, we have to invest in primary healthcare, community engagement, which we are doing it. About 60% of our resources are now diverted towards primary healthcare. And I'm sure we will be successful in this, inshallah.
I would like to thank you again, Doctor. And I'm so lucky that I had the chance to meet you face to face and talk to you. And I want everyone to think and understand your message, because end of the day, when we talk about community and society, I build my society, I help it to grow. And when we want to grow, it's all about, as you said, a collaboration. No one can do things by himself. Okay, government needs to do lots, and we can't wait the government. We need to initiate things by ourselves. And I would like everyone to think about the humanity, the donation, the charity, the understanding of your society. Start from yourself. Don't think about your neighborhood. You do the first step and everyone will come. It's about leading something to go and happen. And I want to call everyone to think, to feel, to donate. Think about your real estate investment, not only for profit. Make it as a way, staycation for your brain, to help others, to feel the happiness in other people's eyes, to share what you're feeling. I'm feeling ease, I'm happy, I'm having a house, my health is okay, I have money to pay for it. Other people, they can't. So at least we need to share this. We shouldn't be selfish. We should share the feelings. And as he's already spent all entire life working to make other people's healthier and happy, we should do the same. And I would call everyone to donate to every foundation that they are really free of cost and non-profitable, like Andas Hospital. You will get all the links. You can go to their website, check the credibility, check how much they are transparent. And really, this podcast, it's not for marketing, not for advertising. It's from heart to heart. I want to touch everyone. I'm Tunisian. I'm not Pakistani. I'm not being paid for marketing. This is really a pure. I just want to make sure that end of the day, I work in real estate, but I'm human. I work to help people to make profits and investments and ROI, but I'm human. End of the day, my credit with God will be more if I work to make other people happy. Then nothing will last in life. We need to work for some day that I know that I'll be in need. It's not only about money. Life is not only money. So just think about it. Be humans. Stay safe, everyone. And I hope everyone to think from the same eye Dr. Abdul Bari see things, and he spent all his life to keep a legacy. What the legacy you want to keep? Help others and feel free and be happy. Our healthcare system is our priority. The environment of community will be sustainable if we do help each other. It's only a community. You can't grow without helping each other. Thank you so much, Doctor. And I'm so glad again. I can't, it's, sometimes when you meet someone as much as valuable as yourself, it doesn't happen every day. And for me, meeting personalities, it's quietly an add value for my career. Thank you so much again. And I want the last word to be from your side.
Thank you. Thank you for doing this. Last word. It's not very difficult. We don't want billions of rupees. Every penny counts. Donate on a daily basis. Sadqa, do sadqa every day. It will help you keep safe you and your family. So you can remember the Ghazwa Tabuk. So just visit Indus Hospital, see for yourself, and if you are satisfied from here, give it to Indus Hospital. Thank you.
Thank you again. Thank you for everyone who's watching this. Please, 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 call to action.